So in each clinic, we all did it slightly differently. Some people had a nurse, some people had an administrator, and we essentially had a list of patients, a long list, I might add. I think we tried to contact about 1,500 patients, and just trying to phone them, text them, email them, look on electronic patient record to see if they'd been seen anywhere else. And it was just that. It was just detective work and trying to get hold of them. Sometimes we were unable to get hold of them, and which is very difficult, and we didn't necessarily have consent to contact the GP. But oftentimes we were able to contact people and invite them in, establish a rapport over the phone, and then invite them in for like a so-called wellness check, because often patients didn't necessarily want to discuss HIV per se, because stigma played a huge role in all this. So invite them in for a wellness check just to get them back into care.
And so what are you hearing back from the patients who do reconnect? Like what explains their journey, what happened to them?
So just a real variety of stories. In some cases, it's down to drug and alcohol abuse, for example, makes it very difficult, obviously, to engage in care. In some cases, it's very severe mental health problems. So somebody with very severe schizophrenia or something like that, might find it very difficult to attend for care. But if I had to say there's one main group, it's of people just living very, very challenging lives with a lot of competing needs. So particularly the African community, because as you will have seen in my presentation, the majority of patients that we did re-engage were either African or Caribbean, and the majority were women. And their lives are very, very hard. They are living in poverty, with poor housing, sometimes with immigration issues, normally looking after their children and trying to earn money. And if you add stigma into that as well, attending for HIV care just falls off the list. Plus, the stigma is huge, people trying to conceal it from everybody. So I'd say if there was one main group, it's a group of stigmatised African women with very difficult lives, and that's the main reason I think that people fall out of care.